Hi, this is Jim Bond with the 13th episode in lessons my caregiver wife and I have learned in 30 years with multiple myeloma. Today's session is on clinical trials. I've completed several clinical trials, and in every one of them I've been treated very well, and I was never treated like a guinea pig. I enter clinical trials when we believe they're the best option for me. My thinking is, why not at the same time try to help other patients by trying to get a procedure or drug approved? Clinical trials are the only way that the FDA approves myeloma drugs, of which we've got many today. But we did not when I started in 1992. My most dramatic clinical trial was about 20 years ago when my local transplant doctor told me that I was out of any options that could help me stay alive and I needed to go to a hospice. I was all done. Instead, I entered a clinical trial. My wife and I left Cleveland, where we live, and relocated temporarily to the greater Boston area, and Dana-Farber entered me into a clinical trial for an experimental drug that clearly saved my life. And that experimental drug got approved in record time, and from then on became known as Velcade, which has helped me and many others around the world. Because of that experience, I became a strong believer in the power of clinical trials. And I entered more. And one of those produced another was for another experimental drug that produced another widely used myeloma drug. Again, it's been used around the world, is being used around the world today. One significant obstacle that may occur to having to leave town for a clinical trial, like I did, is the financial burden of housing when you're out of town. Now, we were fortunate and could overcome that ourselves, but people that cannot, my wife is a longtime volunteer with the American Cancer Society, and she tells me how there are over 30 Hope Lodges around the United States, owned and operated by the American Cancer Society, and cancer patients who are out of town seeking treatment stay for free along with their caregiver while they're being treated. So the American Cancer Society is a place to check if the financial obstacles are facing you, which are very real, and I appreciate that. Well, I've got more to say about clinical trials and our experiences in my book, and all the profits in that book go to cancer charities. And you can get my book by searching my name, Bond, the word book, and the word myeloma. That should get you to it. So I look forward to sharing more of our experiences in the next episode. Thank you.